So I recently had a Dentrix User Meeting up in Seattle, and it was incredible. I mean, we had a full house of engaged listeners, attendees. We had team members, we had clinical team members, we had doctors there. It was really amazing. And so the title of the course was From Chart to Chair, Mastering the Treatment Planning Process for Better Case Acceptance and Workflow Harmony. I know that's a long title, but it was a great description. And I wanted to just do a podcast about some of the most common questions that I had during the course. And I think I'll do some future podcasts about getting into a little bit more of the details, but I wanted to go through with you some of the most popular questions that really drove a lot of good conversation during our user meeting. And so I thought I would just kind of give you a quick recap of that meeting. I will be doing this Dentrix user meeting all over the country. So kind of keep your eyes and ears open to see if I'm going to be in your location. If you want me to come to your town, please drop me a line. Always looking for good places to go where we can have an engaging and fun conversation. So the whole morning session was on treatment planning. I mean, we did 4 hours of treatment planning, and it was amazing. Just filled my bucket. But here's some of the top topics that people really asked a lot of good questions about. Number one was about the case date. Okay, so we're going to talk about the case date. Why is it important? Is it important? What's it used for? Things like that. Linking alternate cases, how to do it. Why is it important? What does it mean exactly? So we'll talk about linking cases. And then printing out your treatment plan and having a really good system, a consistent and clear way of presenting treatment to the patient. And then the last question we'll talk about today is, when do I reject and when do I accept treatment? And why is that important? So those are the 4 things we're going to go through today. So first thing is the case date. So you'll notice when you open your patient chart and you have the treatment plan panel, I always use the treatment planner view. So I always have that treatment planning panel over on the left side. So I can always see what is on my patient's treatment plan at all times. And you'll notice that there's always a case. You could have multiple cases on your patient's treatment plan, on your patient chart, but every patient will have at least one default case. And it could have a date in there from like many, many years ago. And I had questions about like, Dayna, should we update that date? And here's what the case date does. It is tied to the expiration date. And so if you are going to ever increase your treatment plan fees on a global scale, so let's say you're going to do a global scale fee increase, you could tie the fee update to the patient's expiration date. So that's one thing that the case date is used for. Another thing the case date is used for is if you are going to put an expiration date on the patient's individual treatment plan. So other than that, the case date does nothing. And so you could have a case date from, July 15th of, 1999. You have treatment plan procedures in there from, February of 2025, and it doesn't really matter. If you want to update the case date, you could for sure do that. It's totally up to you. If it bothers you, then update the case date. Be my guest. It's totally up to you. But the case date is really only used for expiration date. All right. The other question I got from the crowd that spurred a lot of conversation was linking alternate cases. So this is when you are giving the patient options between, say, a bridge versus an implant, amalgam versus composite, extraction versus root canal crown buildup. And so when we want to give our patient options, then we want to always link cases together. Now, if you ever watch the Dentrix video or in the learning center or their resource center, if you ever look at their resource center, what they will tell you to do is to right click on the main case. Like, let's say, for example, you have treatment planned, scaling and root planing, a couple crowns, some fillings in the patient. These are the patient's like priorities. They need some crowns, they need a filling, some fillings, and they need some SRP. And then the patient also, let's say they have a missing tooth. Let's say they're missing their lateral and they have a flipper there right now, and you want to give them an option between a bridge or an implant. In the Dentrix world, in their resource center, they will tell you to right click on the current case and create an alternate case, and then select all the procedure codes that will duplicate into both cases. I don't do it that way. And here's why. If you're giving the patient an option between a bridge and an implant, and you also have all the fillings and the scaling and root planing and the crowns that the patient needs, all of that is duplicated in both options. And the patient says, you know what, I'm going to think about the implant and the bridge, but I'm going to go ahead and schedule the scaling and root planing now and that filling, on that lower right tooth. And if you have all of those procedures in both options that are linked together, it doesn't work well because you have to pull the SRP out of one of those cases. And if the patient hasn't decided what to do, well, then you're screwed. You don't have a way of just pulling the SRP out. And so here's what I do. I always have the master treatment plan. Those are the priorities. That's your decay. That's your broken teeth, your scaling and root planing. All of that stays in its own case. Okay. Then I create 2 new cases. I create a case for the implant and I create a case for the bridge. So I treatment plan all the bridge procedures. I treatment plan all of the implant procedures, and then I drag and drop them into the right case. And then I only link the bridge and the implant together. Okay. This way, you're able to print out treatment plan estimates independently of each other. So you can print the priorities. Here's what you need no matter what. Scaling and root planing, fillings, crowns. Here's your treatment plan. These are your priorities. And then here's the treatment plan for the bridge, and here's the treatment plan for the implant. Then the patient's going to say, okay, great. I'm going to think about how to, replace that missing front lateral that I have. But I do at least want to schedule the scaling or root planing to start. So let's start there. Fantastic. Now it keeps your treatment plans much more organized. Okay. So then when the patient calls back and they say, okay, now I'm ready. I think I want to go with the implant. Now you can accept the implant case and it will automatically reject the bridge case because they're linked together. And then it doesn't get all messy. Okay. So that's how I do linking cases. Now, I do have a tip sheet for you. If you want to click on the link in the show notes, I will send you my tip sheet for linking cases in Dentrix, and it'll spell it all out for you. It's super easy to follow. Okay. The other question that we got that spurred a lot of conversation was printing the treatment plan estimates out of Dentrix. And so you can customize the treatment plans and it is a workstation specific process. So what I do recommend is meet with your team and decide, how do we want our treatment plans to look when we're presenting it to the patient? Okay. What columns of information do we want? Do we want to have the provider ID on there? Can we take that off? Do we want the insurance estimate on there? Can we take that off? How do we want our treatment plan to look? So one thing that I talked about during my course was the fact that a confused patient will always say no. Let me repeat that. A confused patient will always say no. So I want your treatment plan estimates to be as clear as possible. So try and remove as much unimportant information off your treatment plan as possible. Try and remove things that really aren't necessary. We probably really don't need the provider ID. Okay. And in my opinion, now this is my opinion, in my professional opinion, I never put the insurance estimate column on my treatment plans. The reason I don't is because anytime there's an insurance estimate on the treatment plan, the patient will always ask questions. Well, why is my insurance only covering that? Why is there a zero there? Why isn't my insurance covering that? So what I like on my treatment plans is the fee, the total fee, and the patient portion. That's all that I put on there. Fee and the patient portion. You always, always, always want to focus on the patient portion, okay? Anytime you're going to make a financial arrangement, anytime the patient is going to apply for financing, anytime you're going to be talking about what does the patient need to bring in on the day of service, it's always going to be their patient portion. So why not make that the crux of the conversation? The point of the conversation is, what is this patient's investment in their care? And it's always the patient portion. I leave off all the insurance estimates. So that way it cleans up the treatment plan. It eliminates really unneeded information. Now, of course, patients are going to ask questions about insurance if they want to know. But if we don't provide them with that information from the get-go, more than likely, they're just going to say, okay, yep, let's make a plan for my $500 out of pocket. So you can do that on your treatment plan. Then what I recommend you do is, after you've decided how do we want our treatment plans to look when we print them out from any workstation, I want it to look the same. Then in the treatment plan print window, you'll see in the lower left corner where it says save template, or it says manage template, I think is what it says. You can save the template, and then there's a drop-down menu in the upper left corner. You can just always select that template from any workstation, and it'll look the same from any place. That was kind of a long conversation. That was probably one of our biggest questions we had during the user meeting. And so I really wanted to bring that up. Then last, but definitely not least, is when do I accept treatment and when do I reject treatment? The most important thing to remember in the treatment plan is that you never delete anything out of the treatment plan unless it's a duplicate, like it was added twice by accident, or if it's something that doesn't need to be done. So for example, let's say you treatment planned a crown buildup crown seat, and it ended up you didn't need to do the buildup. Okay, delete the buildup out of there, but that's really the only time you would ever delete anything out of the treatment plan. You're either going to be rejecting cases or accepting cases. And so here's some guidelines that I always throw out is, if the patient is accepting treatment, they have scheduled, they've given you a deposit, or you've linked cases together and they're accepting the implant over the bridge, then you can mark the status as accepted. And then it will help make your case acceptance percentage on the practice advisor report more accurate, or the daily huddle report. It'll make that case acceptance more accurate. Acceptance will also happen when the treatment is completed, so acceptance will happen eventually, no matter what. Now, another reason why you would want to reject treatment is if the patient says no. So let's say you have treatment planned a night guard, and the patient is like, never in my life will I wear a night guard. And so you have reviewed it with the patient a couple of times, you've documented it in your clinical note, the patient says, stop talking to me about this night guard. Then I would make sure the night guard is in its own case, reject the night guard case, and then it drops it off of your active, open, unscheduled treatment. So it stays in the treatment plan, but it does show up as rejected. Another reason why you would want to reject treatment is if you are inactivating the patient. So let's say you're doing an inactivation process and the patient hasn't been in your practice for, a couple years and you've kind of just lost touch with them. So you're going to inactivate the patient. Then I would also reject their treatment. So if they ever do come back, then you're forced to retreatment plan. And so that's also a good time to, reject treatment, is if you're inactivating the patient account. Otherwise, if the patient says no, patients can say no to treatment. It's okay. They may have a broken front tooth and you've treatment planned a crown, but they do have the option to say no. And so that's another reason why you would want to reject treatment. Okay, my friends, I hope this was helpful. We talked about the case date. We talked about linking cases together. Make sure that you grab my free tip sheet on that. We talked about the printer format for when you're printing treatment plans. And then we also talked about rejecting and accepting treatment in this podcast. So I hope this has been helpful. If you found it helpful, please share it. Rate it, review it, give us a 5-star review. We love 5-star reviews just like you do. And I hope that you enjoyed these 17 minutes of time together. So I look forward to watching your journey of becoming a high-performing dental team.